We want to acknowledge this afternoon the presence of the leaders of many national nursing organizations, and 7 of them have been invited to provide 5 minutes of comments to us. So at this time, there are 2 microphones in the aisle. I would invite them to come to the microphone. Just all line up. We're talking about, represented today is the National Institute of Nursing Research, the American Association of Colleges of Nursing, the Organization for the Associate Degree Nursing, the American Nurses Association, the Academy of Medical Surgical Nurses, Quad Council Coalition of Public Health Nursing Organizations, and the National League for Nursing. So could you please give your name and your organization as you begin. You are limited to 5 minutes. I will be your timekeeper. So to keep us on track, but we really are thrilled that you are with us, and we look forward to your comments. Let me remind everyone again that this is just the first opportunity for nursing leaders and anyone listening to me or hearing my voice right now to provide comments to the committee. So this is not the only opportunity, but there are multiple opportunities to do this online. So let's start with, I'll alternate between the mics, so I'll start with the mic on my right.
Good afternoon. Thank you for the opportunity to provide comments on behalf of the National League for Nursing before the Committee on the Future of Nursing 2020 to 2030. I'm Dr. Rumay Alexander, NLN President and Associate Vice Chancellor, Chief Diversity Officer, and Professor in the School of Nursing at the University of North Carolina at Chapel Hill. As the oldest nursing organization in the United States, the NLN promotes excellence in nursing education to build a strong and diverse nursing workforce to advance the health of the nation and the global community. The League represents more than 1,200 nursing schools, 40,000 members, and 25 regional constituent leagues. Today, I would like to focus my testimony on key areas the NLN encourages the committee to consider as it updates the Future of Nursing report. My testimony will focus on transforming nursing education, care of vulnerable populations, which is a subset of population health, innovation in simulation and technology, and the advancement of the science of nursing. I will start on our perspective regarding transforming nursing education. The League continues to promote nursing education as an advanced practice role and was the first national nursing organization to assert that the nurse educator role requires specialized preparation and developed core competencies for the nurse educator. The NLN also developed the Academic Nurse Educator Certification a decade ago to establish nursing education as a specialty area of practice. While different doctoral programs will emphasize practice, research, and education to varying extents, it is imperative that all doctoral nursing programs prepare nurse educators to teach in both academic and practice environments. The NLN's vision is to act as a catalyst to strengthen nursing education's capacity to prepare nurses for the development of viable, comprehensive, and culturally relevant care in a global context. As nursing education is charged with the responsibility to prepare nurses to enter a workforce that is complex, uncertain, and constantly evolving, the NLN recognizes that a critical goal for the future is to endorse academic progression options for all nurses. The licensed practical vocational nurse, typically known as LPN or LVN, workforce addresses a significant voice in the healthcare provider continuum as they provide safe, quality, patient-centered, evidence-based care to vulnerable populations across the healthcare spectrum and possesses the most diverse cadre of nurses in the profession. The League calls for a timely and inclusive way to support and work with our LPN, LVN colleagues. They are a great source of achieving the diversity goals of the profession. In terms of care of vulnerable populations as a part of population health, the NLN believes that nurses provide services from the cradle to the grave and that the quality of care should not be determined by one zip code or community. Diversity and safe, quality health care are inseparable. Diversity encourages self-awareness, legitimacy of all as members of humanity, Respect for all persons encompasses organizational, institutional, and system-wide behaviors in nursing, nursing education, and practice. It is imperative that all institutional leaders create academic environments where diverse faculty, staff, and students can flourish. Academic environments that create a sense of belonging. There must be a willingness to challenge implicit and explicit bias, both personally and organizationally, and also address institutional racism that promotes micro inequities, hostile learning and working environments that ultimately act as barriers to achieving diversity in nursing and holistic nursing education. Nurses on the front lines of healthcare are uniquely positioned to assess for social determinants of health and positively address health equity. Nurses can lead the nation in strategies to promote health equity and embrace this new and imperative leadership role, given who's having the babies these days in our country, and who will eventually become not only our students, but our healthcare providers, as well as through the use of interprofessional collaboration, advocacy, self-care and well-being, political involvement, and community partnerships. From preconception to aging populations, the environment is a contributor to health and illness. Climate change highlights the critical needs for us to consider the consequences of these environmental changes on health. It is essential that nurses responsibly recognize and address the environmental factors that might affect themselves, their patients, and the communities at large. The NLN supports the integration of environmental health policy into nurse education practice and research.
Your time is up, Dr. Alexander.
Thank you
so much for your organization, for its leadership, and for your comments today. I'll go to the mic on my left.
Good afternoon. I am Dr. Ann Cashion, Acting Director of the National Institute of Nursing Research, or NINR, one of the 27 institutes and centers within the National Institutes of Health. I am pleased to be here today to represent the nursing science community and to contribute to this important report on the future of nursing. In the next few minutes, I will describe the essential role that nurse science plays ensuring that future. Nursing science focuses on improving health outcomes of patients and their caregivers. It supports the health research enterprise by bridging gaps between the bench, the research clinic, and communities, and by translating science to clinical care. Nursing science's primary focus is on improving the quality of life, not necessarily on curing disease, and it spans all age groups and various conditions and illnesses. NINR provides funding to scientists across the United States to conduct research in symptom science, wellness, self-management, and end-of-life and palliative care, and to train the next generation of nurse scientists. NINR's work supports the practice of the over 3 million nurses in the United States by developing the scientific evidence necessary for the advancement of clinical practice. For example, NINR scientists discovered biomarkers of neuronal change in athletes and military personnel following traumatic brain injury that one day may guide diagnostic and therapeutic development. And they developed early palliative care interventions tailored to patients with newly diagnosed incurable cancer, leading to improvements in quality of life and mood outcomes. On a broader scale, NINR-supported science has led to the development of robust, evidence-based interventions that have been implemented in multiple community and clinical settings, such as a program that promotes healthy behaviors in low-income settings through positive parenting, and technology-driven decision support tools that use patient data from electronic health records to aid transitions from acute to subacute care. Unfortunately, minority populations in our country bear an unequal burden of disease. This problem is compounded by the fact that, as nurses know, racial and ethnic minorities are often underrepresented in research studies. Nurse scientists have a strong tradition of patient-focused care and partnering with vulnerable communities to recruit participants and achieve positive health outcomes. Indeed, a significant portion of NINR's annual budget goes to support health disparities research. Findings from this research support included exposing the substantial burden of out-of-pocket costs for rural breast cancer survivors, and revealing significantly less healthcare utilization by African Americans in comparison with Caucasian Americans after the 2009 recession. We are very proud of the contribution that nursing science has made to improving health and to supporting the nursing field, and we are excited about what can be achieved in the future. But in order to protect that future, we must ensure the continued growth of the research workforce. However, recent data has shown that the number of students in the PhD programs has decreased. Doctoral nursing programs are not producing enough nurse scientists, even though there is need for highly educated nurses to meet the current healthcare challenges and growing demand for nursing faculty. NINR's robust training efforts uses a multi-pronged approach to prepare a nurse scientist for a successful and fulfilling research career. We support training programs for full-time predoctoral and postdoctoral research training. We support NIH research supplements to promote diversity for groups underrepresented in biomedical research. And we support training programs at the NIH campus, including our long-running Summer Genetics Institute and the highly successful Methodologies Bootcamp. Through these NINR-sponsored training programs, nurse scientists are poised to keep pace with the latest techniques, initiatives, and innovations in science, such as the big data and artificial intelligence, as well as to educate the nursing workforce to become active participants, collaborators, and leaders in the transformation of healthcare. I appreciate the opportunity today to describe for you the importance of nursing science, what the field has accomplished, and why it is so important to ensure its future. As part of the Future of Nursing report, I urge this committee to highlight the importance of nursing science, including the need for more PhD-trained nurses in order to advance nursing over the next 10 years. Thank you.
Thank you. Perfectly on time. Thank you.
Good afternoon. My name is Donna Meyer. I'm the Chief Executive Officer for the Organization for Associate Degree Nursing. And on behalf of the organization, I would like to take this opportunity to thank the Robert Wood Johnson Foundation, the National Academy of Medicine, the committee co-chairs, and the committee, as well as Dr. Susan Reinhardt and Dr. Susan Hassmiller, to allow time for comments at this momentous time in nursing and healthcare history at this inaugural meeting of the Future of Nursing 2020-2030 Consensus Study. It is an honor to provide a perspective from the AOCN membership, which represents more than 1,100 community colleges in our country. These community-based institutions educate over 50% of all of newly licensed professional registered nurses, an average of 81,000 graduates annually. AOCN has been deeply engaged in nursing education transformation since the time of the Future of Nursing, Leading Change, Advancing Health report in 2010. AOCN worked with the Robert Wood Johnson Foundation and the Campaign for Action to support the recommendation of the original report to ensure that all nurses have access to high-quality, efficient options for seamless academic progression. AOCN's continued leadership on these efforts led to the co-founding of the Robert Wood Johnson-supported National Education and Progression in Nursing NEPN Collaborative, with a goal of 90% of new graduates from 2018 to 2025 to have a 90% BSN from the new graduates of ADN programs. As RWJS has said, community colleges are a vital part of the nursing workforce and have the capacity to provide individuals with the ability to launch careers, setting them on a path to achieve goals, and helping our nation meet access needs for an aging and chronically ill population. Nowhere is this more important than in the many communities across the country that rely on these colleges to provide an educational approach that serves as a solid foundation for baccalaureate and higher degree attainment. AOCN voices strong support for the Future of Nursing 2020-2030 report to study the important role nursing plays in improving the health of our communities. As the committee begins to chart a path for this work, ODIN believes it is imperative to collaborate and use the leverage of the role of community colleges in this country as a means to access health care. A recent study conducted by ODIN validates there is evidence of creative strategies for incorporating population health concepts and learning experiences into the community college's students' education. In many ways, these programs are prime exemplars of integrating population health competencies, as these programs are connected to the communities, all the care settings, and particularly those serving a very vulnerable population. ODIN is pleased to see that the committee will take on the need for all levels of nursing across the care continuum to address the many challenges associated with the culture of health and meet healthcare demands. Additionally, we know that individuals fare better when cared for by those who understand their culture and the social determinants of health in their communities. Most community college graduates choose to stay in their community, and as a result, do understand the social determinants of that community. Most community colleges exist in a very wide variety of geographic settings across our country. They provide an important portal for diverse students, as well as offering low tuition cost. These schools are essential to not only meeting the needs of the nursing workforce, but the entire healthcare workforce. This is a dynamic and unique time in the history of our nursing profession as we embark on this new study. Significant progress has been made, but there is still much that needs to be accomplished. There is a synergy now as a result of the Future of Nursing Report 2010, and I feel it is very compelling, and it's a unique time for us all to come together as a unified approach in our nursing profession so that the culture of health in our country is a norm and no longer the exception. ODIN recognizes the importance of this report and that assessing the capacity of the nursing profession to meet the future healthcare needs will only be successful with all of us working together. The contribution that the 1,100 community colleges offer is critical in this national effort to create a culture of health and improve the well-being of our communities. ODIN thanks you all to have this opportunity today to come forward, and we look forward to working with the committee in the future.
Thank you so much. Thank you very much. On my left.
Good afternoon. I'm Ann Cary, and I'm the chairman of the board of the American Association of Colleges of Nursing. We are the voice for academic nursing of baccalaureate and higher degree programs in the country, and we represent over 825 schools of nursing. We also represent 54,000 faculty and 540,000 students in these programs. First of all, thank you for the opportunity to testify and to note that and applaud the results from the last Future of Nursing report and achievements there. We also want to posit that in our own data for AOCN, that actually about 30% of our current enrollment in baccalaureate and higher degree programs do represent groups from underrepresented populations. So much of the progress from the Future of Nursing can really be attributed to our academic schools of nursing. And it's important that we applaud both the catalyst function as well as the synthesis function of the Robert Wood Johnson Foundation and the Academy of Medicine. So as we consider the charge for the new committee and work ahead to achieve this vision driving the agenda, it's clear that academic nursing is at the forefront of this partnership. It's important that there be a paradigm shift to assuredly change how we will educate nurses in the future, especially from continuum of care in our communities and moving from acute care to connected care. More education will need to be provided to the next generation of nurses to use the latest technology, including artificial intelligence and virtual reality, in order for our students to learn and for our nurses to practice in a very disruptive technology world. Already, AACN is engaged in the Essentials document revision, which will debut in March of 2020. In this document, we are outlining the necessary curriculum, content, clinical support, and expected competencies of graduates from baccalaureate, master's, and doctorate of nursing practice programs. The revised essentials will be used to accelerate nursing's role and footprint in the healthcare system and will shape the development of hundreds of programs in this country that are accredited by the Commission on Collegiate Nursing Education and other entities. As part of our work, we're looking at the UN Sustainable Development Goals, publications by the Academy, recommendations in AACN's new Vision for Nursing Education and Academic Nursing, and other evidence with the goal of achieving consensus on how to best prepare a future-proof nursing workforce in the future. So in addition, AACN does recognize the importance of inclusive learning and belonging for students in our environments. Evidence indicates that a more diverse workforce is associated with improved access to care for racial and ethnic minority patients, greater patient choice and satisfaction, and better educational experiences for students. So AACN is committed to preparing a community of scholars, clinicians, educators, policy influencers, and leaders who fully value the importance of diversity and inclusivity and work to promote equity in this country. Over the next 10 years, AACN recommends collaborative action and engagement in 5 priority areas that we would like the committees to consider. The first is refocusing of nursing curriculum. To prepare nursing leaders to be advancers in the culture of health, an intentional shift is needed to refocus nursing curriculum beyond its current emphasis. The committee should consider convening curriculum specialists from across the health professions to develop competencies and a common curriculum which addresses the social determinants of health. AACN can facilitate this work given our leadership with the Interprofessional Education Collaborative and our affiliation with the Federation of Association of Schools of the Health Professions. Number 2, we're concerned about the faculty shortage. So to improve health outcomes and the health of the public, nursing faculty in sufficient numbers will be needed to prepare the workforce of the future. Maintaining a robust faculty population is vital to this work and a real challenge given the ongoing faculty shortage. For example, the most recent data indicates that the number of nurses employed as faculty in 2015, 1/3 of those nurses, of those faculty rather, will be retired by 2025, a very short time around.
Thank you so much for your comments and contribution.
Good afternoon, and thank you for the opportunity to provide testimony this afternoon on behalf of the Quad Council Coalition of Public Health Nursing Organizations. My name is Susan Coleman. I'm a faculty member at Georgetown University School of Nursing and Health Studies and am part of the leadership team of the American Public Health Association Public Health Nursing Section, which is an organizational member. I'm sorry. Thought I was close enough. So I want to begin by highlighting that public health nurses everywhere are just thrilled about the focus of this committee and how nurses can contribute to the culture of health, reducing health disparities and improving the health of the U.S. population. As noted in Dr. Pittman's recent paper, Activating Nursing to Address Unmet Needs in the 21st Century, although a larger branch of nursing has focused on support roles with a defined set of clinical tasks in hospitals, it is also noted that an important branch of nursing that has existed for more than 100 years, and as Dr. Kunaut said, the past is the future, is operating with a holistic focus on patients, families, and communities in the context of relationships, environment, and on social justice. This branch of nursing is public health nursing, a defined area of nursing practice grounded in prevention, health promotion, and working to improve population health. Public health nursing practice is rooted in the community. It's not inside the 4 walls of a clinic or a hospital. We are outside of clinical practice and grounded in deep understanding of and connections to the populations that we serve. A major task before the committee is centering the social determinants of health in the care of nursing provided across settings. We're struck not only by the great promise this strategy holds, but also by the enormity of this task. And the evidence is clear that to rid our society of health disparities, we need to move from addressing the negative effects, health effects that are downstream, or the outcomes that are often called downstream in some of the public health and other literature, in order to attack the thornier and more complex set of upstream factors, things like policies, environmental conditions that are now widely accepted as the causes or the drivers of poor health. Essentially, downstream efforts are directed at specific health factors within the individual in order to manage disease severity through clinical interventions. Midstream factors function at the interface of social needs of individuals within the current healthcare system, such as food insecurity or health literacy. Upstream factors, however, operate at the population or community level, where the determinants of health and/or illness originate, where the focus is on improving conditions in the community where people live, work, and play in order to support health. This is public health's wheelhouse, public health nursing's wheelhouse. One example that I'd like to provide here is of what actions at each level might look like. Consider the case of an eight-year-old African-American boy living in Ward 8 of Washington, D.C., which is one of the most impoverished areas of the city. He has moderate persistent asthma, and his family has suffered generations of oppression from institutional racism, consequently live in poverty and must rely on public housing. Studies have shown that peak flow monitoring and the use of spacers with inhaled medications, avoiding allergens, and being surrounded by more green space and air quality monitoring at the local level are associated with better asthma control. Locating these interventions along the stream that I mentioned, peak flow monitoring, ensuring the child has a spacer, and teaching the parent about allergen avoidance, it really fits into the downstream realm. Incorporating programs that include home visiting to minimize mold allergens in the home, reducing provider implicit racial bias, and having hospitals play a role in local air quality monitoring are useful, prevention-oriented measures that operate within the midstream. Upstream interventions, however, would include the public health efforts of working across sectors in partnership with the local housing authority, urban planners, elected officials, to try to tackle some of the root causes of poor health in select populations. Oops, I got my yellow light there. So I'll skip over that part, but our current system mostly, I'm looking at the yellow light quick. Our current healthcare system currently functions primarily at the downstream level. In recent years, most of public health nursing's practice has had to remain midstream. However, given our focus at the intersection of public health and nursing, we're uniquely poised to influence the health outcomes upstream. For example, through policy development and advocacy. Combining our clinical knowledge with a deep understanding of communities, public health nurses are well positioned to influence policy as being part of the greater profession of nursing. And as has been mentioned, we are recognized as the most trusted profession, which really helps in the policy and advocacy arena. So we encourage expanded roles for nurses in acute and primary care settings, in feeling that we as public health nurses have a role in promoting this along the continuum and helping our partners all work together.
Your time
thank you very much.
Thank you so very much. On my left.
Good afternoon. I'm Dr. Linda Yoder. I'm the immediate past president of the Academy of Medical Surgical Nurses. Thank you for the opportunity to present on behalf of our AMSN president, Robin Hurdle, and our members. Medical surgical nurses are the ones who provide care for you and your loved ones in the hospital. Our practice is the largest specialty in nursing, consisting of an estimated 650,000 professionals. Medical surgical nursing is the foundation of the hospital and community nursing. You know that a system provides the outcomes that it was designed for, and we have a flawed system. In the United States, we have miraculous innovations and outstanding care for some. Yet a woman is 3 times as likely to suffer maternal complications or death if she's Black. Our health sector costs 2 to 3 times that found in other industrialized nations, but we're not living twice as long or as well. 90% of a person's health is the result of social determinants and heredity. Yet as a nation, we annually spend $4 trillion on healthcare interventions that impact only 10% of our health. Through focused attention and action addressing social determinants of health and the factors driving health disparities, this committee can draw a path to a healthier American future, where nurses are prepared to serve, innovate, and lead the way. Yet we know the barriers to this future. We may have the most dynamic and productive economy the world has known, but failures of imagination and policy keep this economically strong nation unhealthy. Our systems for financing healthcare pay for sickness, not health, for procedures, not outcomes. In doing so, they warp the delivery of care against the people paying the highest social prices for it. Among the people paying a high price are people of color, women, people who are economically poor, and people with multiple health conditions incurring unimaginable costs for uncoordinated care. Rural America is paying a high price, and their hospitals are closing. I served in the Army for 28 years, and I can state with authority that my fellow veterans pay a high price. Most veterans do not receive their care in the VA system, and civilian professionals do not always understand veterans' unique health care needs. In America, we also pay a high price in health for failures in technological innovation and integration. Often, nurses and other professionals do not get the patient data they need to make the right decisions every time. And rarely is the patient's health information smoothly communicated to the next step. But in America, discontent drives creativity. That gives me hope. For example, in Del Valley, Texas, where there's a food and healthcare desert, there is no hospital. But nurses from the University of Texas at Austin, working with the local fire department, have made the Del Valley Firehouse the local health clinic. Healthcare is being brought to people in their community, and we witness their health improvement. In low-resource countries, nurses have developed systems supporting new mothers, where they educate lay workers to come alongside them for practical training and teach them how to care for their babies when they go home. In these new models and more, medical surgical nurses work from the front lines to serve populations lacking health and health care. They collaborate with patients one-on-one to find solutions that work. So our counsel to this panel is to plant practical guidance that everyone in the health sector can act upon, from patients to professionals to facilities, systems, health plans, industries, and governments. To the extent that health financing and policy are barriers to health and healthcare delivery, we recommend transforming the healthcare payment system, paying for outcomes and value, and ending laws that keep nurses from practicing to the extent they are educated, can improve care and address challenges in nurse staffing. To the extent information technology has underperformed in health, drive industry to spur innovation alongside the nurses delivering the care. Because healthcare resources are focused on the sickness challenge and not on building a culture of health, we must make a clear path for nurses to drive elimination of health disparities and improve social determinants of health through changes in reimbursement policies.
Your time is up, and we want to thank you for your comments. And we will now listen to our final nurse leader for today.
Hi, last but not least. Good afternoon, everyone, and congratulations on the formation and your selection to this important committee. Thank you for the opportunity to speak today. I'm Dr. Loressa Cole, the Chief Executive Officer of the American Nurses Association Enterprise, the family of organizations that is composed of parent company ANA and subsidiary organizations, the American Nurse Credentialing Center and the American Nurses Foundation. Our vision centers around building a healthier world through the power of nursing. Representing all nurses, ANA engages in practice, policy, and advocacy work dedicated to improving health and wellness by advancing the nursing profession. ANCC promotes excellence in nursing and healthcare globally through credentialing programs. And the American Nurses Foundation seeks to transform the nation's health through the power of nursing via philanthropy. The entire ANA enterprise, along with their state nurses associations, stand ready to engage with the committee and a robust dialogue on the future of nursing. ANE is particularly supportive of the committee's goal to focus on creating a culture of health, reducing health disparities, and improving health and well-being. There are numerous programs underway within the ANA enterprise that can serve to inform the committee's thinking. ANCC's Magnet Recognition Program leverages the alignment of strategic nursing goals with patient outcomes. The Magnet Program and ANCC's sister program, Pathway to Excellence, reflect the highest quality of care for patients, contribute to business growth and financial success, and results in staff, and not just nursing staff, who feel motivated and valued. Learnings from the Magnet and Pathway Recognition programs transcend the acute care setting to also inform leadership, delivery models, and the organization of nursing care across the care continuum, and can contribute to the committee's discussions related to a culture of health and improving overall health and well-being, as well as nurses' well-being and resilience. Both ANA's Substance Abuse and Mental Health Services Administration, or SAMHSA-funded Minority Fellowship Program, and our Center for Ethics and Human Rights can contribute to discussions related to culture of health, reducing health disparities, with emphasis on diversity. ANA's Minority Fellowship Program supports ethnic and minority nurses to achieve master's and doctoral level education in the areas of mental health and substance use disorders. Celebrating its 45th anniversary, the Minority Fellowship Program's over 300 alumni and the current 40 fellows are a substantial source of nurse leaders and expertise dedicated to achieving this committee's goals to reduce health disparities. ANA's Center for Ethics and Human Rights serves as a steward for the Code of Ethics for nurses with interpretive statements. The Code of Ethics is the foundation for the nursing profession and for our calling to create a culture of health, reduce health disparities, and drive to improved health and well-being. The code applies in all settings and to all nurses by speaking specifically to our obligation to address the social determinants of health and work both as individuals and as part of a collective to contribute to a healthcare environment that is conducive to meeting the health and wellness needs of all who are within its sphere of influence. Healthy Nurse, Healthy Nation is another signature program of the ANA enterprise. Healthy Nurse, Healthy Nation builds on the idea that if all 4 million registered nurses increase their personal wellness and then their families, coworkers, and patients followed suit, what a healthier nation we would live in. To date, 85,000 nurses and nursing students have signed on to Healthy Nurse, Healthy Nation, and more than 650 employers of nurses, schools of nursing, and state specialty nursing associations have partnered and made commitments to improve the health of nurses through Healthy Nurse, Healthy Nation. And finally, ANA's partnership with its constituent state nurses associations provides a gateway to registered nurses from across the care delivery and geographic spectrum. We know that there are significant differences in nursing practice, and much can be learned by tapping into the innovative and creative spirit of nurses from the East and West Coast, the Heartland, and North and South. Many of the state nurses associations were active leaders in the first Future of Nursing report and the subsequent Campaign for Action. They should be a significant stakeholder for your efforts to learn from the first campaign. The ANA enterprise looks forward to future opportunities to engage with this committee. We are very pleased that Dr. Allison Squires, the 2019 National Academy of Medicine Distinguished Nurse Scholar in Residence, will be supporting this important work.
And we want to say a big thank you to you for making time to do so. Thank you to all of our nurse leaders who have spoken today. Thank you.